name is Nafis, and I'll be talking about a little context about this. Is that in education, a lot has changed and improved. It has become more interactive, especially with edutech software, which allows students to learn on the go, makes education more fun and interactive. The one aspect that it hasn't reached is the medical diagnostics and surgery and more interactive parts, which require the patient and doctor interaction. So we conducted our own research based on Google Scholar and medical articles, and we found that there is a demand for such software. The current norm is same as with the other edutech test-taking parts, and it benefits having like a long list of test papers as well as medical content, but there is nothing that truly incorporates the interactive element between a medical professional and a patient. We went to interview a few medical students, medical and nursing students around FAU, and what we gain insights from them is that there is very much a demand, and a lot of them were truly excited at the thought of having something more high tech, having more ability to interact with patients on the go or on demand. Having these like software such as the ATI, which allows you to do test prep and then visualize your results. Interviewees have also confirmed that they have like actor mechanisms and dummies that they can practice the simulations on. But again, that's, you need a lab environment for that, and that's more high fidelity compared to like a software where you can just interact with it on demand. We discussed all these requirements, and then we came up with a wireframe, which is going to be converted to a prototype based on feedback with users and of course the discussions in our group. So this is the initial wireframe that we came up with. It's pretty messy, but it's going to be refined in the future. So with that, I would like to end, and my next mate will explain the prototype.
So jumping into the wireframe of our first prototype, the first screen is the case selection screen, where users are able to select the medical domain that they want to work in, like the symptoms that they want to try and diagnose, and they get to choose a skill level or the difficulty level of how hard it is to diagnose that type of disease or domain. There's a scenario that is generated based off of medical data that the system was trained on, doctors' real life experiences based off like medical records. That is kind of presented in like a patient file type of layouts, like the forms you fill out when you go to the doctor. And once the doctor or the user is finished analyzing that information, they can go into actually talking to the patient, ask them how they're doing, get their responses, however you would in a normal doctor setting. And imagine like this is the AR VR type of scenario, so you get to actually get the full body experience, right? You'll notice three things here. You have the health bar at the top, a time on the left side, and a money count or a dollar amount on the right side. So as you progress the system, you're tracking the patient's health status and how much time you took to diagnose, and also how much money you spent to diagnose. You can interact with it, move with gestures, you get feedback haptically and stuff like that. You can then order tests, for example, and it'll be shown as like a projection on the screen. You kind of iterate over these three things of like interacting with the patient, ordering tests, getting reports, and like doing that whole process until you get enough information to make a diagnosis. And once you have a diagnosis, there is going to be some sort of prompt and some form of ASR, automatic speech recognition, to where you can like talk to the system, tell the system what your diagnosis is. Then you can go to the next step, which is creating a treatment or plan of action with the patient and communicating the diagnosis that you've come up with. So this is to help train the real life scenario of talking about medical terms to non-medical people. Patients don't have as much medical experience as you do, so getting that experience as well. So once you have the treatment, then the last screen is the evaluation score. So this takes up all information, what the patient ending health was like, the time you took, the money you spent, compares it to the information we have on file or like in the system about how long it takes on average and on median for doctors to diagnose that type of disease or that type of scenario, and you get rated on a scale, and you can use that scale to either say that you're competent at this level to do this type of medical procedure, or you can go to the next level of like increase the difficulty, get scenarios where like the patient can't communicate as well, or the disease is harder to locate or something like that. That's pretty much it. I guess going with some of the feedback that we got from people before we created this, it was more so about creating that high-tech environment of allowing people to allowing students specifically or medical personnel to train in the in scenarios without having like the financial and people burden, resource burden of having to like hire actors and go through full training in like high cost environment. And from here we'll talk about our usability testing plan of like showing this to actual users again and seeing their thoughts, seeing if there's anything that they would add or change or like to see different.
So I'm going to be talking about the usability test protocol that we will use for this medical diagnosis tool that we're trying to build. So we would have to employ seasoned professionals and diagnostics from different fields, different medical fields. And the reason that we might not want to consider medical students in this testing scenario is because they might not be experienced enough and what is expected out of these scenarios and stuff. So because of that, maybe seasoned professionals, experienced professionals are the way to go. Think aloud is particularly helpful in this case because a seasoned professional, as we said, will go through every stages of the software, speaking out what they are expecting to see and what they are actually seeing. This feedback is especially necessary for us to make this tool as lifelike as it can be, and also they can their input may be necessary for us to think about scenarios that we have not thought about, as well as cognitive walkthrough. We would want to know how the thought process works when they encounter different scenarios when talking to the patients or seeing the test reports and stuff like that. So we have a better idea of how to proceed with the development of the software. So it will essentially be an iterative process where we take some feedback, try to implement them, and then get the feedback on those implemented features and stuff, and then move forward to have a complete prototype of the software we're trying to build.